For me, my staff and I, we're just excited to welcome our children back next week. We're one of the earliest starting school districts in the region. We did have summer programming with our Jumpstart, and I was very excited to see almost 10,000 students that came into our buildings. Over 90% of them were open. It was very smooth. Many of the children were children that had been remote most of the year last year, and we just saw such high energy. And so we want to carry that into next week. I know our teachers are excited. They're all right now as we speak are, in training, or they're setting up their classrooms. And so we also want to make sure that we continue to prioritize safety. We will have COVID testing on all of our campuses. We are asking for our parents to support us in children wearing masks. We're going to ask our staff to wear masks as well, even though the vast majority, close to 100% of our staff are fully vaccinated now. And so we're also going to have vaccine clinics in our high schools. So we want to make sure that we get as many of our children that are eligible for vaccines to take us up on that, as well as community members. One of the concerns that I have is, as we're hearing more and more about these variants, the vast majority of individuals that are having serious conditions are unvaccinated individuals, and mostly adults. And so for us, we just want to make sure that we continue to protect our community. And so that's my encouragement but we'll have testing in every school, we'll have vaccines, and I just need help on having our children wear masks, and I'm going to ask our staff to wear masks, especially during the first semester as we navigate still COVID.
When you mentioned testing in different schools, is that available in case, say, somebody has symptoms, or are there certain people who are going to get regularly tested, or what kind of is the idea there?
So Erica, for us, what was great is that we were able to set up PCR COVID testing every single week with our partner Community Labs. It's an amazing partner, a nonprofit that got started here in San Antonio, and our parents get the results within 24 hours. So it's the gold standard of testing. So we just recommend both our staff who have been fully vaccinated, and our children, to get tested every week. And that way, I have 2 children myself that get tested weekly, and it just gives us assurance as parents, because my children are soon. My son is going to be 11 and my daughter is 7, so they're not eligible for vaccines. And so it just gives us comfort to know that when we see those negative test results every, that they continue to be safe.
You mentioned there were about 10,000 students this summer doing summer school, and I would imagine those were all in person as well.
They were all in person, Erica, and they were doing enrichment activities. So we had STEM camps, we had fine art, fine art programs, and it was across over 90% of our schools were open.
And what was that kind of experience like? I mean, did everything go pretty smoothly, and has that provided a way to kind of transition into the school year?
Yeah, it did, Erica, because like you said, everybody was in person. We encouraged everyone to wear masks. We did have an opt-out for parents who didn't want their children to wear masks, but well over 98% of the families supported us in children wearing their masks. We had no issues in the classrooms. There was just a lot of high energy. The children were excited to be back in school, to see their friends. So for me, and then what it did is, with over 90% of our campuses being open, it was a soft opening for us. So we took care of things like AC, other building issues. So I feel like we're even better prepared for Monday than we would have without the programs.
And I know last year was a little bit, kind of a mix and that kind of thing. What's different this year for you guys? And will campuses look at all different than they looked last year?
So one of the goals for us is our teachers should be focused all on in-person instruction. We are going to work with families who, for example, have children who have medical conditions that are not eligible for vaccines. And so we are we're going to have dedicated teams to work with those children. And so, for us, my goal is, and the reason, Erica, that, I was so proud of last year is that we had just so much trust between our staff and parents. We want to maintain that trust this year. We know that there's still concerns, there's fears, COVID is still with us. But I do feel that as long as people are wearing masks, last year, Erica, when we did we have some great data because we had testing across all the schools. We never saw our positivity rate go above 1%. We were within 1%. We ended the year with over 70% of our children in person at the elementary level, and our positivity rate was well under 0.3%. So it just shows you, and we publish our cases every week. So we're going to continue to do that, Erica, because families can see, school by school, Any child that's exposed, one of the requirements we had last year that I'm going to continue is I want principals or their team members to call the parents directly. Because as a parent, I would want to know personally from the principal or one of their trusted staff to let me know, what the situation is. So that will continue to happen, and we'll still notify parents if there's any cases in the schools.
So that was one of the questions that you just led into that we had from one of the parents here. Isabel wanted to know, will students and teachers be notified if there is a potential case of coronavirus? So that is the protocol. They'll go ahead and call each parent.
We do, Erica, and what we do also is we work directly with Metro Health. So we're very good about being partners with Metro Health. We follow the CDC guidance. So we will continue to notify parents if there's any case in their schools, and we will publish our cases each week, and we show them by campus.
All right. Excuse my eyes for a second. I'm just going to go ahead and read this question right here. Okay. So Lindsay wanted to know, what is the plan? I know you said the positivity rate is low, but she said, what is the plan if there is an outbreak in a classroom, say several students test positive?
Yeah, so what we do, number one, is we notify any parent of any child that's been exposed. That's number one, and that'll be a personal phone call. We then will quarantine children up to 10 days. And then children can come back as long as we'll give them access to COVID testing. And then they'll be able to test and then come back. During those 10 days, we will have activities for the children. Every child will still have their device. They'll have access to the internet. So we're committing to that. And then they'll have continued access to our digital playground, our digital materials. So we'll check in on them, so that they don't fall behind during that period. My prediction, Erica, is that as long as children are wearing masks, we'll minimize quarantine. So I think that's the number one thing that I'm going to keep asking for parents is support me and making sure that our children are wearing masks. That will minimize quarantine.
Great. We had another question also. This isn't super likely based on what we've seen from the state and the governor's office, but Jessica wanted to know that if there is another shutdown and schools are told to close their physical campuses, is there a backup plan in place in case that were to happen?
So here's what's great, Erica. We were launching a one-to-one digital plan, and the goal was to do it over 3 to 5 years. We did it in 3 weeks back in the spring of 2020. So we are set up. Our teachers have been trained. We have a great system with Canvas so that children can have activities. We have multiple digital products that now our teachers are very comfortable with. So if we do have to shut down, we are more than prepared. And we will be, we'll be there to support our families, because we learned a lot of good lessons in the spring of 2020. We carried those into 2021. And so for me, let's hope that doesn't happen. But I think it's still something that we should all be very, very aware of, because there's always that possibility. But again, I'm going to be a broken record on this. This is why vaccines are so important. We just need to get all of our eligible children and community members vaccinated. We are going to bend over backwards to make that as easy as possible. I'll even bus them to vaccine locations, but we're going to have vaccine clinics ourselves on our campuses.
So you've answered most of my parent questions in your answers already, but just a couple follow-up questions just from our end as well. I know one thing that we've heard a lot about is kind of, and to no fault of anyone, but the situation really, there are a lot of students who maybe are not they haven't learned all of the objectives of the year before. So they're going to have a little bit of catch up to do there. What kind of has been the outlook and plan for that?
It's a great question and something that I'm very worried about. So here's what I'm going to ask our parents. I've asked our staff to make sure that our teachers and parents are driving the academic plans. Every school has a customized academic plan that is theirs, and teachers and parents, really are going to be empowered. So, for example, let's say, I'm a teacher of your son or daughter, Erica. You and I would talk and say, okay, let's talk about what the results were last year. We'll have diagnostics in the fall, so we'll get some confirmation of some of the data. And then, we can talk and say, okay, here's some adjustments that I think we can make on the curriculum side. That's all we need. Or maybe your child needs a little bit more support. Maybe it's a program after school. Maybe it's a program on Saturdays. Erica, our parents and teachers will be empowered to make those kind of decisions, and we have the resources. So we navigated the pandemic last year in such a way that all of the federal resources are now available to us specifically to support our children. The other thing, Erica, that's important that our parents need to know, we plan to have mental health therapists and specialists in every one of our campuses. So as parents are seeing, just challenges or needs that their children have, many of our children struggled last year with their social and emotional and mental health. It was just let's face it, all of us as adults, we suffered with that last year, right? So I just want parents to know we will have those resources available. And so again, just partner with your teacher and let's make sure we have a great year for your child.
Great. I don't want to take too much of your time. I know how busy you guys are. I just have a couple more. We did have one teacher ask, and again, this is a question that is kind of answered more so at the state level. Why isn't there a virtual learning option available for parents to just choose from?
Erica, this is very frustrating for me because there was a bill that I had worked with my colleagues with Representative West that was going to pass. We had support across both the Senate and the House, across, it was bipartisan support. We had it. And then, of course, because of the way the session ended, that bill never got a chance to see the light of day. And unfortunately, it wasn't added to the special session. And so, there's probably smarter people than me that can, dissect the politics of all of this, but it was very frustrating for us. So we're going to still continue to advocate for, to give options to our families. I just think, as one of the questions earlier, we don't know what's going to happen over the next 6 months. We hope that as we get more people vaccinated, we won't have another shutdown, but there's no guarantee of that. And so I think we have to be prepared for anything.
And finally, you did mention that last year you had a really, really low positivity rate. Like at the highest, you said it was what, maybe 1% or lower than 1%?
Yeah, Erica, we never averaged out more than 1%. And we ended at about a 0.3% at the end of the year with over 70% of our children, specifically at the elementary level, in person. Overall, we were about 55% of children in person by the time we finished the year.
And at that time, they were fully masked, correct?
And there was a fully masked. So that's why we know, Erica, the number one protection, vaccine.
Yeah.
Right close to that is masking. If our children, and then of course, we're very fortunate that we're one of the few districts in the country that has COVID testing every single week, where children, where our families can get the results within 24 hours.
I think you about covered my bases. Was there anything else that you wanted to make sure that we expressed, or anything that you're excited about or anxious about or parents should know about for this year?
Like I said, Erica, what I'm seeing is a high level of energy from both, children that we had in our summer programs. We've had different activities. We had an activity last Saturday that it was so full that we had unfortunately tell families that we're going to do another one because it was just so popular. And so my staff are excited to see the children. We know COVID is still with us, so please let's continue to make sure we encourage for people to get vaccinated. Support me on encouraging masking up at the schools, and then we're going to have COVID testing. So please, let's take advantage of these safety procedures. We know they work. We know they truly work, and then let's continue to partner together. As long as we're doing this together, Erica, we'll get through it.